or hinder help seeking or suicidality. For instance, in Buddhism, with the reincarnation belief that may be determined as a way suicide can speed that along. Christianity doesn't necessarily mean a protective factor in preventing suicide. So just keep those in mind. And what we want to know about suicide attempters, Chinese suicide attempter is seen as a failure to honor their families. So they're disgracing their families. What do Western relatives and friends do? Rush in to support a suicide attempter. Not really going to happen with the Chinese community. So the Chinese suicide attempter is already at a low point. They failed, they disgraced their family, they failed the attempt, and now their relationships with family deteriorate between the first and second attempt. When someone is unsuccessful in the first attempt, the chances of success increase with the next attempt. So just things to be aware of. Yeah. It says suggested interventions. Chinese prefer goal-oriented solution-focused problem solving. So there's solution-focused brief therapy, cognitive behavior therapy. With cognitive behavior therapy, make sure you modify to include the collectivist culture. First, inquire about somatic symptoms. So ask about that headache, the stomach ache. Then you can inquire underneath and say, how does that stomach ache affect your mood? How does the headache affect your relationships? Apply empathic listening, which we work at with every client. And validation, heal relationships with Imago dialogue from Imago relationship therapy. So we can check in with our clients and say, well, wonder, be curious. I can understand how your stress of your children keeping you up all night is giving you a stomach ache. And that the client's going to tell you if you got it or if there's something else going on. It's another way to connect. Be sensitive to Asian Americans' comfort level in making eye contact. That is a cultural difference. Our client may not be looking directly at us as much as we would like. That doesn't necessarily mean there's a problem. It's just a cultural difference. Also be aware of Asian American sensitivity to giving and receiving praise. I love to give praise, I love to receive praise, but that's not necessarily being empathic with our Asian American clients. Relaxation techniques can lessen discomfort, teach active coping skills to seniors, and encourage social networking. So that would be great on this group. Also with adolescents. However, that social networking may be very different than the social networking for seniors. So we have to discover what is a good solution in social networking per group. Family members must attend therapy. Include the family, especially to address family conflicts with these two groups, the seniors and the adolescent suicidality. To assess spirituality, use Dr. Piedmont's Aspire survey. And Chinese Americans with mental health issues may consult with their priest or minister, not their physician. So who is a step or two away from the minister? Pastoral counselors. So keep that network healthy with your clergy. They can refer the Asian American client to us, and the Asian American client may feel less stigmatized. We're not a psychologist, we're not a psychiatrist, but a pastoral counselor. For Hong Kong Chinese, suicidality seems to be influenced more by the inner self. And again, that is our area, one of our areas of expertise and concern. Okay. And in conclusion, Asian Americans do not have the highest suicide rate among U.S. groups. There's an increase in Asian American suicide rate in these two groups over time as we age. In fact, Hong Kong Chinese male suicide rates are higher than Asian American male suicide rates, with the exception of the 15 to 24 age group. The decrease in suicide rate for Asian American seniors masks this increase as seniors age. Hong Kong Chinese suicide rates decreased over time by age group. So in general, Hong Kong Chinese suicide rates are higher than Asian Americans. So speculations by that team of researchers I mentioned at the beginning that Asian American suicide rates will follow Hong Kong Chinese suicide rates. So there will be a large increase in suicides among Asian Americans. So by going forth with this knowledge, we can be on the cutting edge of prevention, identify early detection in these hopelessness and depression symptoms with our Asian American clients. And by knowing about these risk and protective factors will enable us to collaborate with medical and mental health professionals to provide early detection. Medical doctors need to know about these symptoms too, so that they can refer the client to us. So we need to continue to develop that network among, well, we're going to be building connections as pastoral counselors. And I think that's it. Research reference list, if you're interested, you can just write on my pad over there. And I'll open up the floor to questions.